Karunanidhi, a specialist in physiotherapy in the field of orthopaedics and traumatology. I have my own center, that's a clinic at Nungambakam, Chennai, and my clinic name is Karunanidhi Preventive Health Center. We are totally different from all other orthopedic clinics which is there everywhere in the world. Why I say this is, we do a complete conservative and preventive management of all orthopedic problems which are mechanical in origin, which is not generally made everywhere. So what we do here is, when a patient comes, we do a complete dynamic clinical assessment with respect to orthopedics and traumatology. We make a perfect diagnosis, and unless and until it is warranted, we don't go for any other unnecessary taxing diagnostic measures. We stick to clinical diagnosis. Of course, if it is required, then it is made. After a perfect diagnosis, then a treatment protocol is made and it is followed, and we have a separate protocols for knee, for spine, for all other joints, which is not made elsewhere. And it is a combination of perfect manipulation, exercise regime, and some of the ancient techniques with pranayama and yoga. And mostly we deal with techniques which has a scientific base. Any technique which doesn't have a scientific base, I just exclude them all. We take only techniques which has a scientific base, and sometimes which has an evidence also, and that is generally called as evidence-based practice. In our clinic, we have our own in-house clinical research which is done. We collect the data, and if it is going to be successful, immediately it is put into practice in our clinic. So this is the specialty of ours, and we never take cases which I feel that I cannot give improvement. I take cases which I feel I can do something for them from all ages. Say an example, we have the minimum age of 13-year-old girl with back pain, and we have the maximum age group somewhere around 95 years old person. So this is the general scenario of our clinic, and we have a good follow-up regime also, which no one does again. Hence we have much confidence with our techniques and treatment protocols. We give a follow-up period of somewhere around 5 months, and after the 5th month or after the 5th follow-up period, we collect the video review of the patients, and it is uploaded in our Facebook account. And I request everyone to go and check our Facebook account for all the follow-ups, successful follow-ups, sometimes even an unsuccessful follow-up. Maybe it will be around 2% in our total patient strength. So this is about our Karunanidhi Preventive Health Center, what we are doing here. And one more thing I want to say about orthopedics is, we are not seeing the real orthopedics. We are not seeing the real orthopedics. Real orthopedics is correction without drugs and without surgery. Of course, you can take these two segments help if there is no other chance. Doing an incomplete physiotherapy, doing an incomplete rehabilitation puts the patient ultimately into a surgical area, which in our clinic we don't do it. We see to that we do a complete work which is conservative and preventive in the segment of orthopedics. Thank you.